Try not to be distracted by this parasailer. This is not a green screen, this is real life. If you're prone to melasma, brown spots, or hyperpigmentation, this video will be your guide to help clear your skin and maintain an even, clear skin tone throughout the summer and even beyond. Whether you struggle with keeping discoloration at bay, or whether you're looking for a long-term solution to help even out pigmentation once and for all, this video will be helpful for you. My name is Dr. Stephanie Kappel, and I'm a board-certified dermatologist and fellowship-trained cosmetic dermatologist, and I'm here to be your source of truth and honesty in an industry that's contaminated with misinformation and clickbait education. I make these videos to provide a free resource for unbiased, non-sponsored, and science-based education so that you can beautify your skin at every age and truly age in reverse. All right, my beauties, let's get into it. So what causes melasma, brown spots, and hyperpigmentation? Melasma not only can be induced by ultraviolet light or radiation from the sun, but also from blue light emitted from our devices, our tablets, our phones, our iPads, our screens, even heat. Just in hot yoga, even if you just didn't go out in the sun at all or weren't exposed to any infrared or blue or UV light, you would still get melasma from heat alone. So how do we control it? And what is the difference between certain melasma patches and others? Why does sometimes melasma go away a lot quicker and easier than other stubborn areas that just never seem to go away no matter what treatment you try? And that is because when you look at skin under the microscope on cross-section, there's layers to the skin. And melasma and hyperpigmentation has to do with an irregular and uneven distribution of the melanin into the skin at different levels. It could be superficial, it could be mid, it could be deep, or it can be a combination of all those different layers that give melasma what we call a recalcitrant characteristic, meaning it's very resistant to therapy. So understanding how the melasma is presenting, how deep it is, and what treatments are going to be effective in clearing it is really, really important and key in all treatments. Now, brown spots, which we call in dermatology solar lentigines, are usually from the sun, and they're just brown spots which happen to be increased with melanin synthesis when exposed to increased UV light, and is more associated with sun damage and can potentially be correlated with photo damage that can lead someone to skin cancer down the line. Not from the brown spots themselves, but as someone getting a lot of brown spots, that's an indication that they're getting a lot of photo damage. Now, melasma, chloasma, hyperpigmentation, solar lentigines, what are these all effective from? And there's a lot of exogenous factors, but also endogenous factors like hormones, different hormone ratios, different hormone fluctuations, premenopausal, postmenopausal. Even when you're pregnant or during the postpartum period, you can have accentuation of certain areas that get more hyperpigmented than others. So we do know that there's a hormonal influence as well. And this not only can be involved with melasma, but chloasma and other hyperpigmented skin ailments as well. It has to do with the melanin, which is a pigment element in our skin, and it's produced by the melanocytes, which are the pigment-producing cells that live in our skin. Everyone, regardless of their skin color, has the same number of melanocytes, which is the pigment-producing cells in our skin, but the amount of melanin that those skin cells produce, or melanocytes produce, may differ. And when the melanocytes are stimulated by any type of trauma, whether it's ultraviolet light or sunshine, blue light emitted from our devices, our iPads, or screens, or even something like increased heat, like hot yoga or going in a sauna or working out or being in a hot temperature or a hot climate, is going to, through the heat stimulation of those melanocytes, and make more melanin. So a lot of people will say, doctor, I stay out of the sun and I use my helio care and I wear sunscreen and I'm still getting melasma. Oftentimes it's either from the fluorescent lights in our office or from the blue light emitted from our screens or from just being in, say for example, hot yoga or having a hot warm temperature. A lot of LED at-home masks and LED at-home lights can cause hyperpigmentation. So when you look at skin in cross-section under the microscope, there is superficial, mid, and deep deposition of melanin, which is the pigment. And if it's irregularly distributed, then it will present with hyperpigmented patches or macules. In dermatology, a macule is just a small little area, less than a centimeter. A patch is a larger surface area of skin. And so that's why sometimes melasma will be more stubborn in other areas than other areas of your face. For example, I struggle with melasma, and I have since I was a teenager, and mine is most prominent on my forehead, and it's easier to treat like on my cheeks and on other areas of my face. And that's because the melanin deposition is usually deeper or full thickness. So if someone comes in for a laser for hyperpigmentation or melasma patches and certain areas lighten up a lot faster than others, it's usually because that pigment is a little bit deeper. So when you're talking about skincare actives and when you're talking about lasers to target melanin and pigment without causing hyperpigmentation, you have to almost have extra x-ray vision when I'm looking at my patient's skin and scanning their skin and thinking, is this melanin mid, superficial, or deep, or a combination of different areas and different areas of the face. And so when you look at skin under the microscope, you'll literally see with someone who has melasma skin, the pigment is irregularly distributed through different levels of the skin. And people who have even tone, which means their melanin is all in the same plane, when you look under the microscope, it's all in the same level, that's when people have that glow. And that's getting the melanin all to be in the same epidermal plane, and that's what gives skin that very uniform pigmentation look. So regardless of their skin type or skin color, when it's all the same color, it's when all the melanin is very uniformly distributed, and you can achieve that with lasers and certain active ingredients in skincare products. Are brown spots, melasma, and hyperpigmentation truly reversible, or just something that you're going to have to manage for the rest of your life? And truly, certain types of hyperpigmentation are reversible, but as with many dermatologic conditions, it's easier to control and not to cure. So it's hard to stop the triggers that are causing melasma for someone, for example, who is out in the sun, or someone who is staring at a screen all day like I am right now, or for someone who is a hot yoga instructor. You don't want to modify your lifestyle or cause any lifestyle changes to stop the melasma from happening, but what you can do is healthy long-term habits to help manage and keep the melasma at bay. Now, sometimes it's a transient flare, for example, with different hormone imbalances. If you're postpartum, if you're perimenopausal, if you're breastfeeding, if you're on a new method of birth control like an IUD or a combination birth control pill. But we're always in flux and changing, and our skin is an outward representation of things going on in our body. So with different changes in your stress level and your environment and things that you come into contact with internally and externally, there could be certain times in your life where melasma or hyperpigmentation can be more of an issue than others. Now, for people who are pretty consistent with pretty consistent clinical presentations of hyperpigmentation, whether that be melasma, so lentiginous, brown spots, what have you, usually to get from point A to point B to help clear the hyperpigmentation and even the skin tone and even the color of your skin to where it's very nice and smooth and balanced is usually a bigger jump than just maintaining. I always tell my patients it's like training for a fitness competition. Going from not being fit to getting at the level that you would be at a fitness competition takes a lot of work. But to maintain those results after you already have the results is a lot easier and may just be a very simple modification, like using a vitamin C every day, being more compliant with your sunscreen, maybe taking HelioCare, which is a fern-based, almost internal sunscreen that's in a pill form, a supplement form. So usually I counsel my patients when you're trying to clear melasma or even pigmentation, whether that be a combination of different lasers or just topicals alone or just lifestyle modifications, to get to that clearance where you're achieving your goal is a lot harder than when you maintain it with maybe just topicals or maybe just a laser twice a year or maybe a laser once a quarter or maybe something that you can do at home. So it's not, I don't want people to feel defeated like I'm gonna have to struggle with this for the rest of my life, but a lot of dermatologic conditions like rosacea, seborrheic dermatitis, psoriasis, eczematous dermatitis are things that we can't cure but we can control. But once you do the work to get to your new baseline, it's a lot easier to manage and control long term than it was to get to that point from your baseline that you're starting off with. So what worsens melasma, brown spots, and hyperpigmentation? Now, there could be internal and external triggers that influence the rate of melanin synthesis by the melanocytes, which are the pigment-producing cells in the skin. And common things, most common is usually ultraviolet light or sun exposure. That's why usually on the left side of the face in the United States, where the driver's side is usually with more sun exposure, you'll have more melasma or accentuation of hyperpigmentation on the left side versus the right side. Versus in the UK and Australia, where the driver's side is flipped, they usually have more sun damage or brown spots on the right side of their face. So usually sun exposure over time can accentuate hyperpigmentation. Environmental pollutants, blue light, HEV light emitted from our devices and from our screens can accentuate hyperpigmentation. And as I stated before, heat can also accentuate hyperpigmentation. There can also be internal sources of hyperpigmentation induction, and that usually includes hormones, different hormone fluctuations, as I just referred to earlier in this video, different forms of birth control, different places where you are in your cycle, or if you're childbearing age, during pregnancy, during the postpartum period, during the breastfeeding period. I remember when I was breastfeeding both each individual kiddo of mine, I remember the hyperpigmentation in my melasma was way more flared than it was when I was even pregnant. So it just can change with different hormone fluctuations. Also, other endocrinopathies or other endocrine hormone imbalances in the body, your cortisol level, your thyroid function. There's a lot that goes on inside of our body that stimulates the melanocytes to produce more pigment. And you have to remember that melanin synthesis is just a protection mechanism for our skin, to protect our skin from trauma. And ultraviolet light radiation, HEV light from our devices, is trauma to the skin. So we naturally will secrete more melanin, which makes us darker or makes us patchy in our pigmentation, but that's your body's defense. So when you stop the trauma or the stimulation, or if you reverse the reaction of the melanocytes, that's what helps keep the melasma and hyperpigmentation at bay. Avoid these treatments and products to make melasma and hyperpigmentation worse. So at-home LED lights and light masks, especially the ones that emit heat, can also be inducing hyperpigmentation or worsening of melasma. I see it in my patients every day in my private practice, and sometimes people will come in saying that they notice melasma, brown spots, or pigment alteration in their skin with hyperpigmented patches from the use of at-home devices. Anything that's going to give off heat can cause the melanocytes, which are the pigment-producing cells, to make more melanin. So if you're noticing worsening of your melasma or worsening of brown spots and you think, where is this coming from? See if you've been starting an at-home device that could be correlated in time with worsening of melasma or hyperpigmentation. Not all of them, and not with every individual skin type, but we do see a large amount of people coming in for lasers like the Pico laser or Clear and Brilliant or Fraxel or YAG for treatment of hyperpigmentation, and it has been associated with the heat emitted from the at-home devices, the LED devices. So other things to watch out for, just day in and day out, being on our screens, our iPads, our phones, our monitors. The HEV light that's emitted from these devices can stimulate hyperpigmentation and stimulate melanin secretion from the melanocytes. Remember, the melanocytes are there to protect our skin cells, and they have little arms that reach into the epidermis and infuse melanin, which is pigment, into the keratinocytes. They synthesize melanin, which is a multiple step pathway that requires enzymes and coenzymes, and that's how a lot of the active ingredients that treat melasma work, by inhibiting steps in the melanin synthesis pathway. You could think of it as a ladder going from point A to point B, and taking out multiple steps of that ladder, you can't make melanin pigment as easily. And some melanocyte stabilizing active ingredients and skincare products will also help stop transmission from the melanin from the cell body of the melanocyte through all the branching arms that go out to the keratinocytes, which are the skin cells that line the epidermis, the outermost portion of our skin. And the irregular distribution of melanin through the melanocytic arms of the cell into the keratinocytes gets inhibited, and that's a way to decrease melanin synthesis. So upregulation of melanin synthesis happens from HEV and blue light emitted from our devices. So using sunscreens, mineral-based sunscreens are my preferred method of sunscreen. It just reflects, not absorbs, the photons and the ultraviolet radiation, blue light from our devices, and instead of absorbing it. And then also iron oxides in sunscreen is really important too, because not only does it protect the skin from HEV light from our devices, but also environmental toxins and pollutants that our skin encounters on a day-to-day basis. I would avoid microneedling and microdermabrasion for patients who are at risk for hyperpigmentation. The traumatization to the skin from microneedling can be really catastrophic, and I've seen lots of patients in my office who come with irreversible, sometimes, hyperpigmentation and hemosiderin deposition from microneedling. So you guys know, if you've watched my other videos, I'm not the hugest microneedling fan, and watch my other videos to see why. There's a lot of marketing and a lot of hype behind it, but there's a lot of complications. Number one being hyperpigmentation that can occur secondary to microneedling and or microdermabrasion as well. Elocor, the new microcoring technology, is only FDA approved for skin types Fitzpatrick 3 and lighter. So for darker skin tones, it's not that you can't use that device, but you have to go to an astute clinician who will be able to appropriately pre and post condition the skin to stabilize those melanocytes. And even in doing so, pigmentation might be a risk of that procedure. So I would avoid it if you have beautiful olive skin tones, and if you're wanting to be risk averse, avoiding hyperpigmentation from microcoring, microneedling, microdermabrasion, and also lasers, you guys. So an area of my expertise and a large part of my laser fellowship training, after completing a dermatology residency residency and getting board certified in dermatology, I went on to pursue a fellowship in lasers. And laser medicine is a very intricate, very intense laser fellowship where you're doing laser cases with a world-renowned laser specialist behind your back, breathing down your neck, questioning every move you make. But by the time you're done with treating thousands and thousands and thousands of patients under the scrutiny and tutelage of a mentor, you really are very well versed with lasers. You speak the language, you understand the settings, you understand the wavelengths, combinations of lasers, the fluence, the spot size, the pulse width, the number of passes, the combination of different wavelengths, the theory of selective photothermolysis, the different endpoints for different lasers, and it's just way too much information to cram in like a 2-day Vegas course. So a lot of med spas either will say, we don't want to treat darker skin tones or skin that's at risk for hyperpigmentation, but that's because they don't know how. But if you go to a laser specialist who understands lasers and understands how to treat skin of color and darker Fitzpatrick skin tones safely and effectively with lasers, hyperpigmentation will not be an issue. However, if you go to a chain med-spa clinic, if you will, and have your skin treated by someone who's not very well versed with lasers or who's not comfortable treating darker skin tones, then you can get into trouble and hyperpigmentation can be an issue. So it's always beneficial to proceed with caution, but the things that I would avoid are not wearing photo protection. You should always photo protect even if you're indoors under fluorescent lights, get emission from your devices, microcoring, microneedling, microdermabrasion, anything that's going to produce heat like at-home devices, like the LED masks. And then also, I never tell my patients who enjoy heat-related activities like hot yoga or saunas or steam rooms to stop doing that, but just realize that you may be stimulating your melanocytes to make more melanin, and so maybe take a precaution to maybe use more vitamin C or an antioxidant in your skincare regimen to help stabilize melanin synthesis so that you offset the risk of hyperpigmentation from encountering those daily triggers. And things to be careful with, the skincare actives that can exacerbate hyperpigmentation is anything that cause irritation. So if you're using like a tretinoin or you're using an AHA combined with an antioxidant with a scrub and an exfoliant, you might cause irritation to your skin, and whenever your skin is red, there's increased blood flow to the skin, and that increased blood flow is going to supply the melanocytes with more nutrients, which makes them have increased productivity and make more melanin, which will cause hyperpigmentation, irregular patches throughout the skin. So it's not any one skincare active that you have to avoid, but if there's one that's a little bit more abrasive or harsh or causes more irritation on your skin, just take it down a notch and kind of compensate by using a little bit more moisturizer or some type of barrier repair, restorative, active skincare product to kind of offset that so that you don't hyperpigment. Also, I know that it was a TikTok trend for a couple months to put lemon to bleach your skin. That is going to cause something called a Burloak dermatitis and is going to induce hyperpigmentation of your skin. Avoid citrus, avoid lemon, avoid anything that's going to cause hyperpigmentation, especially when you're trying to use it to bleach hyperpigmentation. The use of hydroquinones, I could do a whole separate video on it, but proceed with caution when using hydroquinone. When it's distributed and prescribed by a physician and in a low dose and with a certain schedule, and taking breaks and prescribing it with a very adherent treatment plan, it's a very safe, effective way to fade hyperpigmentation. But using a dose that's too high or for a prolonged period of time, which you can see with some of these online stores where you can actually get prescription medication that's usually regulated in the United States, you can kind of get it on the black market, and it's a very high percentage of a hydroquinone, and you're using it for an indefinite period of time, you can have something called ochronosis, which can cause paradoxical darkening of the skin. So just be aware of that. So those are the treatments and actives that are off the top of my head that I say to avoid when you're trying to avoid hyperpigmentation or worsening of melasma. Another thing that I wanted to mention is hormones. So I'm actually on the birth control pill. I'm on a combined estrogen pill. I struggle with melasma, but I've kept it at bay with my MD or vitamin CFK and with quarterly Clear and Brilliant laser treatments that I do on myself. Sometimes I'll do peels, and I think that it's something that I have to counterbalance. But if you're ever inducing endogenous or exogenous hormones into the body, you can rev up your melanocytes, as we see with pregnancy and the postpartum period, where you can have a flare of melasma or darkening of existing moles and all the hyperpigmentation sequelae as you see with hormone fluctuations in the body. So the best lasers for treating melasma, hyperpigmentation, and brown spots is not a one-all be-all cookie cutter one laser that works on every everyone. My office is a laser center in Newport Beach, California, and I see patients on a day-to-day basis with darker skin tones with hyperpigmentation, and knowing what combination of lasers to use is very different and customized for each individual patient. So everyone has different skin tones, different skin histology, different skin thickness, different predisposing risks, if they're on hormone therapy or if they're postpartum or if they're perimenopausal or if they're in the sun a lot or if they have a certain genetic predisposition to hyperpigment or have beautiful olive skin tones. As I said before, lasers are my area of expertise, and I subspecialize in treating skin of color with lasers safely and effectively. And it's not a clear cookie cutter one size fits all situation. Each individual skin type is different, and I always evaluate the patient and kind of get his or her downtime expectations, level of discomfort that they're willing to endure, and we combine different lasers in addition to usually skincare actives depending on the patient's expectations. How fast do they need the treatment? What are their long-term goals? Now, people come in and they're like, my daughter's getting married in a month and I need my skin perfect by then. We're gonna have a different treatment plan and protocol than someone's like, I don't want any downtime, I don't want any discomfort at all, slow and steady wins the race, I'm in it for the long haul, and I want to help lighten up my pigmentation and even out my skin tone. So there's different options with different lasers for each different situation, and the lasers that I usually combine are the Pico laser, Fraxel 1927 nanometer handpiece on that device, which usually needs before and after care with skincare actives to help prevent hyperpigmentation from that laser. And then Clear and Brilliant, which is one of my favorite lasers. It's a Clear and Brilliant, the newer device that can use both dual wavelengths in one treatment session to actively treat not only the texture, pore size, stimulate collagen, but also safely and effectively treat hyperpigmentation. Now, Clear and Brilliant, for those of you who don't know, is a laser with no pain, no downtime when done correctly. And we do use numbing cream in the office, but with the numbing cream, it's a very comfortable, painless procedure. And it was actually engineered to treat melasma safely in darker skin tones. So it's one of my favorite lasers for treating melasma. But sometimes there's more stubborn spots that need a Pico Way laser or a Pico Shore or a YAG or a Fraxel. It's good to know that there's different options based on your skin type, how fast you need to get your results, how long-term is your plan, and what is your downtime. Is there no downtime? No, for patients who want just like a lunchtime treatment and they can go back to work or to their social activities without anybody knowing anything was done, Clear and Brilliant would be probably the laser for you. If you're willing to endure some downtime, 1 week of little scabby kind of crusted areas in the areas treated with the Pico laser, then that's something that we can look into. But there's multiple lasers and a combination of these different lasers that's customized for each individual patient of mine who I see in my office. So a lot of people ask me about tightening devices and hyperpigmentation. Does Thermage cause hyperpigmentation? And the answer is no, which is great because Thermage is one of my favorite tightening devices for lower face laxity, under eye wrinkles, fine lines, and for help snatching the lower face, the neck. It's one of my favorite treatments, and there's no risk of hyperpigmentation regardless of skin color with that device, which makes it a very universal and versatile device, and it's really helpful for tightening skin for people who don't want to undergo surgery or have more invasive procedures. The heat, whether it's coming from radio frequency or microfocus ultrasound, is deeper into the skin to stimulate collagen. If you look at the skin on cross-section, it's an arc of radio frequency or penetration of energy heat that stimulates collagen synthesis, but it's deeper, so it doesn't affect the hyperpigmentation ability of the epidermis to darken with treatments, which makes it really universal and a very versatile in-office procedure for lifting, tightening, snatching the jawline, firming up the neck, brow lift, under eye, rhytids and wrinkles, you name it, without the risk of hyperpigmentation, which makes it very universal and versatile and a workhorse in my office. Chemical peels for hyperpigmentation. Chemical peels actually work very well, but you always have to be mindful of pre and post conditioning the skin with skincare actives like a hydroquinone or non-hydroquinone skin brightener to help manage and augment the results to make it more of like a 1 + 1 = 3 situation. One of my favorite peels is a TCA peel or Jesner's peel or a glycolic acid peel, and even more so the ZO 3-step peel, because that's a combination of low percentages of some of the most impactful active ingredients for a very light but very effective skin peel. And sometimes we'll combine peels with lasers, but again, only a trust and astute laser provider who is highly trained in lasers to perform peels in combination with laser treatments. But these can be very effective even in olive skin tones for treating melasma and hyperpigmentation. So how to treat hyperpigmentation at home. So melasma, hyperpigmentation, brown spots respond beautifully to antioxidants, especially vitamin C. And vitamin C, the most impactful vitamin C derivative is L-ascorbic acid, and that's contained in my vitamin CFK, which took me almost 3 years to perfect and formulate, but it's a game changer and unlike any other vitamin C on the market because of the way it was engineered. So a lot of vitamin C products will not contain L-ascorbic acid in it because it's very unstable, it's hard to formulate, it's hard to understand the scientific intricacies of that molecule to keep it stable. Now, being a dermatologist spending 20 years studying the skin, I know exactly what skincare actives need to go in what areas of the skin and how to get them there and how to remain stable and effective. And that's why I wanted to come up with my own skincare line. Now, set aside, a lot of vitamin C formulations won't contain L-ascorbic acid because it's the most difficult to formulate and engineer and have it be effective and stable and really give results without becoming unstable and decaying by the time it hits the skin, which a lot of vitamin C formulations do. So first off, you always want your vitamin C to be in a either nitrogen-lined airtight chamber, not in a dropper, because when it's oxidized to the atmosphere, it decays each time. It becomes unstable and ineffective. Also, vitamin C in the L-ascorbic acid form half the time just sits on the top layer of the skin and never penetrates and gets through the epidermis where it needs to go to be effective. And it has to do with the extracellular milieu, the chemical configuration of a histologic component of the skin. There's a lot that goes into it. So knowing what assays to run and how to do immunohistochemical stains on skin biopsies, we've really perfected our vitamin CFK and other vitamin C formulations. I always suggest that you look for making sure that there's an L-ascorbic acid in it, and if it does, make sure that you're getting a response within days of use of this product, because if not, that's how you know the proof is in the pudding. If you're not getting results, it's not effective. And you also want to make sure that it's not in a dropper and it's in an airtight chamber to protect the gold that's inside that product, because once it's in a dropper, it's being oxidized and it's becoming destabilized and ineffective. There's other antioxidants that kind of help augment the response of vitamin C: kojic acid, azelaic acid. There's lots of different acids, lactic acid, glycolic acid, and you always want to get a vitamin C formulation that has other acids in it that are also going to inhibit the melanin synthesis pathway. But just remember, L-ascorbic is the most impactful. You just won't see it in all vitamin C formulations because it's just such a pain and so difficult to formulate, but we're able to engineer it and formulate it and perfect it, and that's why the vitamin C FK gives next level results. Other melanin inhibiting active ingredients: hydroquinone, which I touched on earlier. Just be very careful where you're getting your hydroquinone from. Make sure that it's a provider that's dosing you and getting you on a treatment plan that's appropriate and not going too high of a percentage for too long of a chronicity of it. And other acids like THD, which is another form of vitamin C, and there's other forms of vitamin C that are effective as well, and you can combine those with other acids too. So vitamin C, again, is the most impactful and has almost literally got attacked by a huge white water beetle. I thought it was a hummingbird. I don't know, it's like some water bug or something. This is terrible. Where was I? So in addition to vitamin C, which is an antioxidant, other acids are also really impactful for the skin. I really like glycolic acid, lactic acid, azelaic acid. I'm sure I'm forgetting some, but always make sure that you're using a combination of different acids that is giving you results. If you don't notice a result after using a skincare product for about a week, then something's wrong. It's always really important to make sure that you're getting a result. Now, your melasma patch may not fade all the way, but you should see the melanin and the melasma kind of becoming reticulated, almost like lace-like, and then breaking up and getting smaller and smaller and more faded. Now remember, if the pigmentation is deep, you're looking at the epidermis on cross-section, there's different levels of melanin distribution. It may be lower to where an active ingredient in a skincare product is not going to be enough, and you might need like a laser to break it down. And the way lasers work is by the theory of selective photothermolysis. I hear myself dorking out. I'm going to try to pull back, but I'll explain in English what this means. This theory of selective photothermolysis is melanin as a pigment molecule is coherent with a wavelength coming from a laser that is collimated light photons that are blasting up that little pigment in the skin, and then your immune system comes and clears it away. Or the broken down melanin and pigment gets kind of exfoliated off the skin and it peels off, and where there was a once existing brown spot, you know how beautiful, healthy skin underneath. So that's the way it works. And when pigment's a little bit deeper, and it's usually what we call recalcitrant, meaning not responding to treatment, sometimes a laser or something more effective like an in-office procedure is needed to augment the results from just just using at-home skincare products. I hope I didn't lose anybody with that one, but basically, if the pigment is stubborn, it's probably deeper and you need something that's more than just an active ingredient from a skincare product. Okay, Justin's making dinner and my kids just came in from surfing, so I'm gonna go be a mom now, but thank you guys so much for joining me in this video. Be sure to subscribe and hit the notification icon so you don't miss next week's video, where we're gonna be talking about all things lip lifts. So non-surgical and surgical lip lifts, how they can change the face, how they're performed, what to expect, some before and afters, and how you can prepare and see if you're a candidate for a lip lift surgery or treatment. So be sure to tune in, subscribe, hit the notification bell so you don't miss that video, and we'll see you next week. Love you guys.